The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is a double board certified plastic surgeon, Dr. Ahmadi. Dr. Ahmadi is the founder and medical director of Avant Cosmetic Surgery in Sugar Land, Texas. We've invited him on the program today to discuss the keys to creating a natural looking breast lift or augmentation. Dr. Ahmadi, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, and we've had you on the program before talking about the lipotuck.
Correct.
For those that don't know about Avant Cosmetic, tell me about it.
I do mostly cosmetic surgery, and that mostly involves facial rejuvenation, breast rejuvenation, and body contouring.
Okay. You do facelifts as well.
Yeah. And that can involve short scarf facelifts or more involved neck lifts. I do a variety of fillers, including Botox, and moving down, there's always the breast augmentation, breast rejuvenation, including breast reduction and lifts, and there's the lipotuck that we talked about.
Yeah, the lipotuck, we had you on the show before. A lot of response from that.
A lot of response.
A lot of people.
A lot of happy patients.
So that's a tummy tuck.
And very aggressive liposuction, that's right.
And very aggressive liposuction, but not a lot of guys do it.
No, it's not really designed for the male body because most men carry their fat, as you know, inside, and it is not really amenable to liposuction and skin removal.
So for women? It's
mostly for women, and the ladies have had some extra skin and some extra fatty tissue around the torso to give them a very natural look around the corners, to create a very natural waistlines and a very flat upper abdomen, and get rid of those bra rolls that they always complain about.
All right, okay, on to the breast. But first, your background, your training. Double board certified plastic surgeon. What are the certifications? I'm
board certified in general surgery, and then I moved on to become board certified in plastic surgery. I went the longer way because I felt that it was better for me to get a lot of training, and that has helped me a lot in my career right now to be able to take care of my patients very carefully to make sure that there are no complications.
Moving on to the breast, what are the different categories of patients that you see?
Well, the ladies come into the office with a variety of desires and complaints and issues, but to break it down for you, basically the breast rejuvenation is either breast augmentation or breast reduction or lift or a combination of these procedures together.
Now, we invite you on the show to talk about how to create a natural looking breast.
That's right.
It seems straightforward to me.
It is not really. Actually,
I mean, it seems that everybody's doing them the same way, and you one of the things you say is
it's quite tricky actually. In order to a natural breast, if you look at it, is there are a couple of factors. One is the cleavage. The cleavage needs to be addressed very carefully, and people, for the most part, think that the cleavage can be modified. But the truth of the matter is that you're born with your cleavage, and if you try to modify it too much, that's when you end up getting the very unnatural look that you try to avoid.
So there are surgeons that dig into the area, cut it.
They try to overdevelop the pocket and forcefully push the implants towards each other.
And what happens?
And basically end up seeing the edges of the implants because they have thinned the tissue so much and the implant becomes so much closer to the skin.
Interesting.
That it loses its natural look that was meant to have.
What are some of the motivations that you hear on these consults? Why do they want to do it?
I hear a lot of stories. I hear the stories of the younger ones who are obviously flat chested, they don't have a whole lot of breast tissue, and breast tissue is very important to the well-being of a lady. No matter how you look at it, it is part of their body, and it's important for them to have enough breast tissue so that they look natural and out there.
Okay.
So there's always the young lady who sits in the back of the class, probably shy, doesn't have a whole lot of friends, doesn't hang out in the in the cafeteria too much, and you probably don't see her swimming out their way. That's a typical young lady who's flat chested. Then you see the other ladies who have used to have quite a amount of breast tissue, and after breastfeeding and age and all that, they saw the breast tissue flattening away, and then bring me pictures of those younger days, and they wish to look
kind of restore that volume.
Restore that old volume. So there are those who never had it, or those that had it and want to go back to having it, and there are of course the older ladies who through age and all that have lost breast shape and volume, and would like some restoration in that sense. So aside from wanting just to go bigger, they trying to look more symmetric. They're trying to look much better out there in their sexy clothing. I mean, you've seen the fashion shows, you've seen the fashion magazines, and you see the ladies showing their breasts. It's part of our culture now.
Cleavage, right?
Yeah, cleavage. You know, it's all about cleavage nowadays, and that fullness that you carry around, you know, on your chest. It's become part of our mainstream culture, and these people are just trying to be involved and fit in, basically.
Let's talk about technique, because even though it seems straightforward to me, let's start there with over the muscle, under the muscle. I mean, what do you do? What's the best?
My approach to breast is probably the less you do, the better.
What does that mean?
Well, the more you try to manipulate the breast, I think you end up damaging that breast tissue more, and that later on causes more problems with scarring.
Okay.
As for the techniques, obviously, you know, when breast augmentation started, the implants were placed above the muscle or below the breast tissue.
Okay.
Nowadays, we know that the better pocket for it is below the muscle, because that protects the implants a lot more.
So for the most part, you always go below the muscle?
In general, unless there is absolutely a very, very good reason not to go under the muscle.
Well, why do some guys just do over the muscle? I mean, it's still being done today. Is it an easier procedure, you think?
It is much easier to do, but it's not a better procedure. I think the plastic surgeon should take the time to be trained well enough to handle that pocket, which is the below the muscle.
Okay, what about the incisions? Some, you know, I guess through the belly button, the armpit, through the nipple area.
You have to listen to the patient.
Under the fold.
Exactly, you have to listen to the patient.
So what's best?
Commonly, the easiest, the one that disrupts the breast tissue the least, is the best. There are people out, some of the ladies come in and say, I want to be able to breastfeed afterwards, even though there is no guarantee to be able to breastfeed at all.
Okay.
But that is a determining factor, because if you go through the areola, through the nipple, then you're going exactly through the breast tissue that she was trying to tell you to not to disrupt, because she wants to be able to breastfeed. So
you don't like going through the nipple area?
Not necessarily. You try to match the procedure for the patient and what.
So where do you go?
Most plastic surgeons, including myself, end up going through the fold, because your breast is
underneath
the fold, underneath. Other ways of going it, as I said, is through the nipple. But if you're going through the nipple, you probably should reserve that procedure for somebody who wants a slight lift of the nipples, or needs a slight lift of the nipples, because you're already giving them the scar. You might as well take advantage of it and make sure that the implant sits very naturally and centered under the nipple areola complex.
Now, what do you say? Now, I talked to a surgeon. He says, but going through the nipple area gives you more control of the implant, of that pocket.
Not necessarily. Once you're inside, you should be able, if you know what you're doing, you should be able to control that pocket from any point, no matter what your access point is.